Thank you very much for the introduction, and also thank you for taking your time to join this presentation today. So I'm an academic based in Imperial College London. I've been working there for over the last 6 years. So I've also established the Center for Biochemical Sensing based in the Department of Chemical Engineering in Imperial College London. So my laboratory consists of around 15 to 20 postdoctoral researchers and PhD students. And we roughly work in the field of biochemical sensing technologies for applications in wellness and point of care and intensive care diagnostics. So I'm just going to start with an overview of where we are in biosensing. So in the 1960s, we had some of these dipstick assays. They are colorimetric test strips, and they allow us to semi-quantitatively determine the concentrations of biomarkers in urine samples. Obviously, they're very subjective depending on who's reading them. In the 1980s, we've seen the emergence of electrochemical probes that allows us to measure the concentration of glucose in blood sample through finger prick testing. And finally, in the early 2000s, we've seen the emergence of wearable devices. So the currently only wearable device in the market is for glucose management in diabetes. So this constitutes of what we know as current diagnostic approaches for patients. One of the current sort of paradigm shifts around healthcare focuses on specifically moving from the already diagnosed patients to early stage diagnosis of patients before the diseases can advance to a late stage. So in the next decade, we're expecting to have non-invasive and minimally invasive diagnostics, but also there will be a greater importance of real-time monitoring technologies. So one of the bottlenecks at the moment in the field of continuous and real-time monitoring is the development of biosensors that can measure biomarkers in a continuous manner. So this will also constitute a significant paradigm shift. So we want to move from the existing methodologies and all the way to preventative healthcare. Right? So this will involve early stage diagnosis of a wide range of diseases so we can intervene. Hence, it will also reduce the hospitalization costs overall. So my group overall focused on 6 major research themes, including our holographic sensing technology, fiber optics. We heavily invested a lot of time on contact lens sensing technologies, dermal probes, fluorescent technologies, and also wearable devices. Now, in 2017, we had an idea around the possibility of rendering the human skin as an interactive display for applications in monitoring metabolites in interstitial fluid. So some of the ideas that we were considering were around utilizing the tattoo technologies to sense a wide range of biomarkers for applications in wellness, but also disease monitoring. So in sports medicine, what sort of applications do you envision in this area could be useful? Yeah. Oxygen labeling, yeah. Levels, yeah. Oxygen labels is a good one, right? What else? It's a good one. Glucose is an obvious one for diabetes management. That's right. What about sports medicine? Let's talk about performance enhancement of the athletes, right? What sort of biomarkers, should we look at?
What do you want to say? Lactate.
Lactate is a very important one. Yeah, definitely. What else? Temperature. Dehydration monitoring, electrolytes especially, monovalent and divalent, sodium, potassium, calcium, magnesium, zinc, and others. Cortisol for stress management. That's a key one. What else? Creatine kinase, autonomic function. What else? What about dopamine, testosterone, and other key important biomarkers that we have to measure? So we have to.
In terms of the doping control, so certain biomarkers for that. I mean, that's not my expertise, but for diabetes.
Yeah, absolutely. So that's another important area. What else do you envision? So let's move on, think about a little bit more important molecular diagnostics? What about sensing important key enzymes or DNA or RNA, for example, diagnostics that we can perform? Any thoughts on that? Yeah.
I think the thing I'm trying to get my head around is the issue of real time versus something which is more of a chronic adaptation. So those things that you're referring to would be something which would be more chronic, reflecting sort of a training status or epigenetic phenomenon, whereas the things which we mentioned earlier would be more real-time markers.
Exactly, exactly. So such an interactive display can focus on, as you said, on chronic conditions and as well as very dynamic changes throughout the day. One example is cortisol, for example. So I would like to monitor changes in cortisol levels. So there will be many more applications in this area. So some of the concepts that you mentioned are right. So we've started with the idea of utilizing this platform, and we wanted to exploit it for applications in real-time monitoring of biomarkers. So the first step in this process is to utilize a tattoo gun to inject the this biosensing chemicals inside the skin. So we are tattooing them in the dermis layer of the skin. So you may want to envision, this is a little bit futuristic, but we're going to get there maybe in 10 or 20 years. So you're just building the ground for the next generation of what we call functional tattoos and dermal sensors. So when we tattoo them inside the skin, so this is an animal skin model, this is basically how it looks like. So you have multiple strikes and you have to basically tattoo them at different angles. So we are talking about here around 5 to 10 microliters of biosensing reagents in the skin. So once we tattoo them, this is how they look like. Okay, so we are looking at here a pH sensor in an animal model. So it's an ex vivo model system. So when we change the pH all the way from 5 to 9, there's a significant shift in colors that can allow us to determine the hydrogen ion concentrations in interstitial fluid in real time. So based on these color changes, we can quantify the pH. So similar with the glucose sensor, so there's a shift from all the way to 0 to, in this case, 55, so out of the metabolic range, but you can only focus on the first 3 up to 6 to 10 millimoles. So there's a significant change in all the way from yellow to green. Same thing with albumin, for example. We can also multiplex these devices. So you can imagine this, it's a tattoo that you have on your arm that is constantly in a dynamic way changing its color in response to different biomarkers in interstitial fluid. So we do know that from the literature, interstitial fluid is a very valuable bodily fluid, and it's only exploited at the moment for continuous glucose measurements. So there's a very big scope around the utilization of these bodily fluids. So I hope that this won't scare you if you don't have biochemistry or chemistry background. So this is just basically concept of type of chemicals that we are utilizing for sensing pH, for example, methyl rate, brominal blue, and phenolphthalein. So this is basically the data points that we obtain and its analysis. This applies also to glucose, in this case, the glucose oxidase peroxidase reaction, and this is the albumin sensing compounds. Now, other than these 3 important biomarkers, we've also looked at fluorescent systems. So fluorescent probes are widely utilized in vitro diagnostics around the world in laboratories. And we wanted to exploit that platform as well. So it's a fluorophore, basically consists of a carboxylic acid group that responds to changes in pH. We've also looked at ion sensing, in this case, the sodium ion sensors utilizing diazo 15 crown 5 sort of receptor. As the complexation happens, there is a shift in the fluorescent, relative fluorescent intensity, and that allows us to quantify the concentration of glucose, although there is some level of interference from other ions as well. This is another one for diazo 18 crown 6. So this is for potassium ion sensing measurements. So this is basically how it looks like. So we can have a pH sensor, sodium sensor, and potassium sensor. So the application in sports monitoring is the monitoring the hydration status of an individual as they are undergoing some sort of exercise and training. Now, the way that to read these sort of sensors are in 2 ways. So if it's a colorimetric sensor, you can basically look at the colors and determine the changes just by looking at it semi-quantitative manner. But when we want to do quantitative measurements, we do need to have some sort of analytical device. So the analytical devices that we are talking about here must be portable and low cost and should be affordable for everyone. So in this case, we construct this small portable spectrophotometer system. So basically, you can just place it on your skin on top of the tattoo, and it consists of several LED lights, or it may be a white light if you're utilizing a colorimetric sensor. So the camera, the CMOS camera on the smartphone allows us to capture an image of the tattoo, and it produces a quantitative result. So the smartphone comes with an application. So you can, for example, measure weave history and carry out certain diagnosis reports based on that. So this is how it looks like. This is an app designed for pH, sodium, and potassium measurements. So you can capture one assay or multiplex assays at the same time. So in this case, the sodium ion concentration was around 149 millimoles, and you can also track the concentration of sodium ions based on hours or days. This is a continual measurement, so it's a one-off measurement you have to carry out with this device. So you can enter all sorts of information about the patient's age, weight, and so on, and you can also inform the patient whether their pH, sodium, and potassium levels are within the physiological and normal range. So next topic I want to talk about, I'm going to shift the gears now, is related to the traumatic brain injury. I hope that some of you guys are excited about the game, right? Springboks, yeah? Yeah, it's going to be very exciting. Yeah, so you guys yeah. Cool. So obviously rugby is an exciting contact sport, but there's also a dark side to it. So the dark side is a quarter of rugby players are injured every year, and it has one of the highest rate of injuries among all contact sports. Recently, there's a very important lawsuit going on around the rugby sort of players. So recently, as you know, NFL players have sued some of the main organizations like NFL, and major rugby organizations are being sued by the ex-players. So it's going to almost like $1 billion lawsuit going on. This is due to the major injuries that have occurred during the when these players were playing, but also the injuries that they have to sustain and bear after they have stopped playing rugby. So most of the players tend to develop, and they have high propensity to develop, dementia and neurological disorders, even in their 30s and 40s. So this is due to the significant concussions that they have on their brain. So this is how it looks like when you have a patient sort of rushed into an emergency room, usually from a contact sport in rugby or any other sort of impact to the head. So the patient is unconscious and intubated, and they are not able to provide any sort of diagnostic information to you. So the first thing that's normally carried out is to take the patient to an imaging facility, MRI or CT scan, very quickly. This is to prevent or determine and assess the edema in the brain. In the next step, what happens is that a small hole is drilled through the skull, and the pressure is relieved, and they drain basically CSF, certain amounts of CSF just to stabilize the brain. So in terms of the injury itself, the primary injury is irreversible. So that's the damage that's been done, cannot be reversed. And what we are trying to prevent here in the management of the traumatic brain injury is the secondary injury. So secondary injury is partially reversible, and we can prevent further damage due to edema and swelling in the brain. So I just want to give a further picture of it. A lot of players, rugby players, that ended up basically some of them paralyzed or significant brain injuries. So there's a higher risk of developing life-threatening neurological diseases. So that's very important. The second point is that they are more likely to experience dementia. There's a 15-fold higher risk of developing motor neuron disease than the general population. So they suffer greatly after they basically retire in their 30s and 40s. Now, one of the diagnostic approaches that has been utilized in neurointensive care units consists of inserting a pressure probe in the brain. So when the patient is intubated in the neurointensive care unit, their brain pressure has to be monitored on a regular basis until the patient can be discharged in maybe in 2 to 3 weeks of time. So what we wanted to do in this project is to expand the portfolio of sensing capabilities in the clinical diagnostics. So in addition to the pressure, we can monitor a wide range of metabolites that can allow us to determine the course of traumatic brain injury and prognosis. At the same time, it can allow us to maybe administer useful medications to manage the secondary injury. So some of you who may be working in the field of traumatic brain injury may be aware that almost all clinical trials in the past 3 decades have failed. I think I guess same thing applies with the spinal cord injury as well. So there's a significant need for medical diagnostic technologies, first of all, for us to understand what's happening in terms of the metabolic function and neurophysiology in the brain. So the second point is that if we can have some sort of useful information, especially real-time information, we can intervene and manage the condition, but also at the same time, we can provide and develop the right clinical trials, because we are just going to inside this this clinical trials using just neurological assessment based on the condition of patient. So we don't have any type of quantitative test or diagnostic technology to assess the condition of the brain and neurophysiology. So this is exactly what this project is trying to focus on, to developing quantitative diagnostic technologies that can monitor the brain in real time in terms of biochemical changes. So we've developed a fiber optic sensing platform that can be inserted through the same port that is utilized for draining the CSF in brain. So there's already an existing procedure to drain the CSF. So we are using exact same port to insert this fiber optic probe. The reason why we've chosen fiber optic sensors as opposed to electrochemical or electronic sensors is that this sensing technology is compatible with MRI and other imaging technologies. So if you were to use any type of electronic probe, they can be MRI conditional, even though they produce an artifacts in imaging process. And the patient may need to be taken to MRI on a regular basis throughout the treatment as they are staying in a neurointensive care unit. So a fiber optic probe in this case is not electronic system, and we don't have to remove the probe. So this is very important if it consider the ascending bacterial infections that can occur in hospital settings. So the probe cannot be removed and inserted back during imaging process. So that's why we've developed this platform that can be compatible with MRI imaging. So this sensing technology consists of several sensors. So this includes, for example, dissolved oxygen, glucose, to monitor the energy metabolism. We have a pH sensor, for example, and a temperature sensor for calibration. I haven't included in the slides, we haven't published the study yet, but we have expanded portfolio to include electrolytes, including sodium, potassium, calcium, magnesium, and zinc. We have also done protein sensors, IL-6, IL-10, and tau, some inflammatory biomarkers, lactate and glutamate as well. So we've greatly expanded that portfolio. Hopefully that study is going to come out in the next 6 months of time. We had approximately 200 patient samples in this study, and we've evaluated the changes in biomarker concentrations and how it reflects at different stages of traumatic brain injury. So the fiber optic sensor here consists of an optical probe at the distal end of the sensor that is basically interacting with the cerebrospinal fluid and brain interstitial fluid. And when we carry out the measurements, we ended up with large data sets. it's a real-time monitoring technology, and we feed that to a computer algorithm. And one of our students is interested in working now, expanding that to AI-based platform to correct for the background noise and to achieve predictive analytics. So the predictive analytics here is also a key concept, because we want to predict any sort of abrupt changes in brain physiology as the patient is undergoing a treatment. Maybe they may receive certain medication in the neurointensive care unit. So basically, we are exploiting both the hardware platform and the software technologies in order to obtain and improve the quantitative data. So I just want to give some examples of how the sensors work. For example, the pH indicators are based on simple sort of colorimetric reactions. We've utilized liquid crystal display technologies for measuring temperature. We have utilized, for example, ruthenium complex-based sort of molecules for fluorescent, in combination with fluorescent quenching effect, in order to get data on dissolved oxygen, and the glucose oxidase reactions for sensing glucose in this case. So we, in addition to the CSF samples from humans, in clinical trials, we also utilize ex vivo brain models in order to monitor and simulate the changes in brain physiology in real time. So in this example, it's the same size as like a human skull model system, and we have a lamb brain, and we change the CSF biomarkers in CSF in real time. So this is how it looks like, for example, a patient who's healthy, and the changes, for example, pH significantly decrease, and in mild and severe traumatic brain injury. So we can also track the changes in dissolved oxygen and glucose concentration in real time. Now we are also expanding the capabilities of materials. So one of the challenges that exists at the moment in the field of the implantable probes is around the materials choice. So what happens is that when you insert any sort of probe inside the brain, it produces at some level some sort of foreign body response, and there's a protein formation and capsule formation normally that affects the sensing sort of measurement process. So we are developing new types of sensors, for example, hydrogel optical sensors. So instead of, for example, using a glass or a hard polymer, we are using materials that we adopt from contact lens industry, because we do know that the materials utilized in contact lens industry are biocompatible. And so we've adopted a lot of materials from that field. I also wanted to talk about this. This is a different topic that we are developing in our lab, is that I had this idea around utilizing contact lenses as a lab-on-a-chip device to obtain quantitative data. So I went to the lab, and so that was like about 6-7 years, and I designed this small microfluidic chip. So as you know, that my contact lenses are widely utilized for vision correction and cosmetics industry in general. What I wanted to do is that I wanted to access the tear film in order to get some quantitative data from the tear film. So I constructed this platform which has a sample tear collection device, sort of unit, as well as 4 different sensing chambers. So it's a multiplex device that allows us to quantify pH, glucose, protein, and nitrates. So in order to get the data, we can, for example, take a picture. So this is another device based on the contact lens sensor. So we can monitor, for example, electrolyte concentrations or important metabolites in tear film, which are also reflective and could be potentially used as a surrogate medium for the brain physiology and blood. So this is how it looks like, for example, when we measure the electrolytes. We've also designed UV sensors. So this is for allowing us, this allows us to monitor the intensity of UV light in the ambient environment. So it can be in the form of a bracelet, textile, or epidermal device, can be worn in a sunglasses sort of format, contact lens, even tattoos. So a friend of mine got this tattoo and actually tested this on his arm. So basically you can see the changes in the intensity of this colorimetric dye as the UV and UVB intensity changes in the environment over time. We've also developed a smartphone application, so you can use a smartphone application. Basically takes an image of this colorimetric sensor and can provide useful information whether you need to use sunscreen or not. Now I'm going to talk about our work, our commercial work in the sports medicine area. So we have one of the founders of this company is from the Olympic team of Netherlands, and he approached me a while ago, and he wanted to build a device that can allow monitoring the hydration status of athletes in real time. So we've designed this small microfluidic device that has an electrochemical probe in it. So you basically use it as a patch, and it can monitor the concentration of sodium in real time. So it feeds basically data wirelessly to a smartphone. On the right-hand side, you can see an athlete using this wearable device. So you can see these changes in sodium ion concentration. So we can inform the athlete or individual in this case to hydrate themselves and maybe take some supplements. So it's a quantitative diagnostic sort of approach. Another company that I'm involved is Biosensing Ltd in London. So this company is producing a wearable device for applications in stress management and well-being. So the idea is to utilize field effect transistor-based systems to measure the concentration of cortisol in real time. Right. So we are trying to expand the portfolio around neuropsychiatric sort of disorders in general in this project. So I'd like to thank my collaborators as well. So I work in collaboration with a wide range of clinicians and academics across the world. So I also would like to thank our funders who have generously sort of supported our research, including UKRI, Institute of Cancer Research, Royal Society, and Royal Society of Chemistry. Thank you very much.